Now, if you think about any traumatic incident, let's say the conflict or the violent extremism or tsunami, fundamentally, these are experiences that are not normal. These are not the average day-to-day experience, right? Tsunami is not average day-to-day experience. Conflict, rape, none of these experiences are normal in that sense, right? So when it comes to the human person who survive these experiences, given that the experience itself is abnormal, there is no normal way to react to them. I mean, if you really ask yourself, is there a normal way to react to being raped? There is none. Is there a normal way to react when you see your parents or your neighbors being killed in a conflict? There is no normal way to react to these situations.
I am a co-founder of the Easter Attack Survivors Project and the Sri Lanka Reconciliation Movement. Welcome to the first episode of my podcast, where we will be learning about various aspects of peace building and its related domains. Today, my guest is Dr. Udeni Appuhamilage. Recently, we've been working with her when she came down to Sri Lanka from Japan to work with some of the victims and survivors of the Easter attack. And we had the opportunity of meeting with her and talking to her. And I thank you, Doctor, for accepting this request and taking your time off to be a part of this episode. To start off, I'd like to ask you to introduce yourself to the audience who will be watching this episode. Perhaps what different roles you play, like what are the different hats you wear, just a little bit about yourself.
First of all, thank you so much for inviting me. I really appreciate the opportunity to share some of my ideas. And as you said, I am a researcher. I think that's the main hat that I'm wearing. I'd like to identify myself as a researcher. In addition to that, and when it comes to research, primarily my focus is trauma. But then within trauma, different populations. So survivors of Easter attack would be one population that I'm currently working with. But before that, I've worked with survivors of the tsunami, the conflict in Sri Lanka, and a lot of other kinds of survivors like child abuse, domestic violence, rape, all kinds of survivor groups. And the focus is on trauma. So researching is one of the main hats that I think I identify with. The other one would be an academic. I've been teaching for the last 12 to 14 years, I think, universities, undergraduate and postgraduate students in Sri Lanka as well as in Australia, in the US, and now in Japan. So teaching would be another passion, I would say. And I'm a clinical psychologist, so I see clients, again, in Sri Lanka and then in Japan also. Primarily in the Japanese context, I work with the US military bases here in Japan, so a lot of soldiers and their families. In addition, of course, other clients also come for therapy. And I'm also trained in anthropology. My PhD is in anthropology. So when it comes to research, I try to combine the two, so sort of clinical psychology and anthropology both together. And then personally, I'm a mom. I have a son who's everything. So I would say those are the main hats that I'm wearing.
Thank you. That's really nice to hear. And you play a lot of roles. Very interesting. And I'm looking forward to this conversation which we're going to have. So I think my next question to get to know you more is, you've told us that you are you're trained in clinical psychology and you're also trained in psychological anthropology. So since the target audience for this podcast is beginners in the field of peace building who need to understand what peace building and the process is like, I'd like you to explain a little bit about what you think, in beginner terms, clinical psychology and psychological anthropology is all about.
there are a lot of similarities, actually, more than differences between the two fields. Um, both anthropology and clinical psychology at some level is about the human. We work both of these are social sciences, so trying to understand human behaviors, human feelings, and also cognition. Cognition, in lay terms, is the higher order mental capacities that we have. So language that we are using right now would be a cognitive capacity, decision making, thinking, perception, creativity, problem solving, higher mental capacities that humans as a species have. So when it comes to all these capacities of the human, whether it is emotions, behaviors, cognition, both anthropology and psychology are quite interested in these fields. So that would be a similarity. One of the biggest difference, and also in terms of methodologies, I think there are a lot of similarities between clinical psychology and anthropology. Observation, which is key method in both disciplines, for example. So methodologically also how we produce knowledge in both these disciplines, there are similarities. The biggest difference between the two would be that when it comes to the clinical psychology, there's this specific focus on the individual compared to anthropology, which is more about the group. So the focus is more towards how the group functions and the individual as one micro unit of the group. And also within anthropology, there is this sort of extended, very broad focus on ecosystems, culture, social structures, policies. Not to say that these are not important when it comes to clinical psychology. Of course, we understand the individual within the context, but I think the focus starts from the individual and then goes into the group, compared to anthropology, where you start with the group and come into the individual. So the emic-epic approach, methodologically speaking, that would be a big one of the biggest differences between the two. And another difference would be this sort of clinical psychology is informed by the medical model to a great extent. So a lot of focusing on problems or pathologies in that sense. Whereas anthropology try to understand human behaviors, not necessarily to problematize it or not necessarily to pathologize it, but to understand how these behaviors have come about because of contextual factors, whether it is culture, whether it is history, geography. Having said that, I have to say that within clinical psychology, we have this special is the wrong word, I think, a group of people who identify themselves as critical clinical psychologists, who really disagree with the medical model, who really question and criticize the medical model, and then move towards more of an anthropological understanding of human pathologies. So, for example, if you take something like depression, right, which is a classic psychopathology, from a purely clinical psychological perspective, it is a pathology. So you have symptoms and then you have treatment. But when people who are more towards anthropology, within psychology, but more towards an anthropological understanding of these pathologies, try to argue that depression is also an expression, a language in that sense, that is defined by historical, social, religious forces. So, for example, if you're familiar with Professor Besekara's work on depression, where he talks about how he has done this study with a Buddhist community in Sri Lanka, where some of the things that these communities, if anything, aspire to give up and break bonds and meditate and move away from society, and this sort of kalakirima, that's the word that he uses, that people have towards lay life, which can be a symptom in depression, but within the Buddhist community, it's not a symptom. It is something that people actually try to develop. So developing that very critical understanding, which is a very, I would say, an emerging field within critical psychology, which I belong to. So rather than going with this pathological medical model within clinical psychology, also there are people who try to incorporate anthropological understanding into it and develop a more broader understanding of human behaviors that otherwise are labeled as pathological.
So, where do you think, so with the years of experience that you have had in understanding and learning about the two different fields, on which side do you probably stand on or agree with?
I would move away from the medical model very clearly. Not to say that there are no disorders, there definitely are disorders. Like, for example, if you take something like schizophrenia, like it's a classic psychosis, a serious medical psychopathological condition, and they do need interventions in terms of psychiatric treatment and psychotherapeutic treatment. But but the point is, even when it comes to conditions like schizophrenia, there are research that shows that the symptoms that people come up with have a cultural meaning, cultural implication. So, for example, kind of hallucinations that people may experience or delusions that people may experience are defined by the historical, cultural context within which the individuals have lived their lives. So, not to just say, okay, this is something wrong with their brain, but to understand these expressions, human expressions of whatever difficult experience that they had from a more broader social, historical, political framework. I would of course move towards that. It's actually called social constructionist view. I would move towards that way of understanding human pathology rather than limiting myself to a very very predefined medical model.
Okay, so when you do work with people and patients, you take the approach of unpacking all of that rather than just, prescribing medication. And do you like go through the process of explaining to them the history of whatever the symptoms that they're explaining to you?
A lot of my work, within psychotherapy, there are different approaches, and because I've been teaching, I have been trained in many approaches. So it's a combination. So from a more humanistic approach within psychotherapy, it is about allowing people to build that insight within. It's rather than me telling them, it's actually about asking the right question at the right time so that they themselves build those insights. It's those aha moments in them. Oh, this is what is happening to me. That understanding that they themselves build, which is the key when it comes to healing, rather than an external person telling them. Then it is sort of like lecturing, which is what within the medical model happens. Actually, the doctor tells the patient, okay, this is what is wrong with you and this is what you need to do. Psychotherapy is very different in that sense. It's not about telling them what's wrong. Rather, it is about working with the person so the person himself or herself understands what is going on with them. So when it comes to the historical understanding, most of the time psychopathologists are developmental. So, their childhood experiences have a lot to do with the kind of symptoms that they express as adults. So really looking into childhood experiences and re-narrativizing. So they have one understanding of whatever that has happened to them in their childhood, but then questioning that understanding for them to recognize that they have figured a singular narrative. This is what happened to me, and they're stuck with that singular narrative. But then as the external person questioning it and making them think about it, questioning it, try to see things that they may have missed or misinterpreted, misunderstood, and then re-narrativizing these experiences through which then they gain new meanings. Within psychotherapy, that is how I would explain how change happens with people. Prescription of medications. In the US, there are some states where psychotherapists can prescribe medications. In Japan, psychotherapists cannot legally prescribe medications, and not neither in Sri Lanka. So here it would be psychiatrists, and sometimes for clients or patients, you do have to recommend that they seek psychiatric help because the symptoms have gone to such an extent. There is a biological imbalance in terms of hormones. When we recognize that this is not something that we can work with just through building insight, we do recommend them for psychiatric help also. And the vice versa happens too, where psychiatrists refer patients to psychotherapy.
Thank you. So we were just talking about the process of going back to your childhood and your history and unpacking what you might be going through, but I'd like to also talk a little bit about you're a trauma consultant. You had mentioned that you're a trauma consultant. I'd like to talk a little bit about, in the context of the absence of peace and the presence of conflict, and thinking about Sri Lanka as well. What is your take on, or what can you say a little bit about what trauma really is in that context?
Trauma, I mean, thank you for asking that question, because it is my field and there's so much I can say in response to this question. But for the most part, I think when it comes to practitioners, whether they are health professionals or humanitarian workers, peace builders, there is this, I think, sort of a commonly accepted understanding that trauma is a pathology, it's a sickness, right? There are trauma-oriented treatment programs, there are medications for people who are diagnosed with trauma-related symptoms like post-traumatic PTSD. However, again, reminding ourselves of the critical psychological approach to this, one of the things that critical psychologists and anthropologists also keep sort of through research show is that we have to be very careful when it comes to labeling trauma as a pathology. Why do I say so? Now, if you think about any traumatic incident, let's say the conflict or the violent extremism or tsunami, fundamentally, these are experiences that are not normal. These are not the average day-to-day experience, right? Tsunami is not average day-to-day experience. Conflict, rape, none of these experiences are normal in that sense, right? So when it comes to the human person who survived these experiences, given that the experience itself is abnormal, there is no normal way to react to them. I mean, if you really ask yourself, is there a normal way to react to being raped? There is none. Is there a normal way to react when you see your parents or your neighbors being killed in a conflict? There is no normal way to react to these situations. So what we need to understand is the moment that we label their reactions as traumatic, so that they are abnormal, I need to fix you because you are traumatized now. This understanding is based on an assumption that we seem to be making that there is a normal way to react, which is why we are saying, okay, this reaction is unacceptable, we need to change it. But if you really get into it and ask yourselves, is there a normal way to react to these situations? I really don't think there is, right? When it comes to PTSD, the diagnosis, DSM-5, the fifth version. DSM is the Diagnostic and Statistical Manual. This is where all the disorders are described, right? The first criteria to diagnose PTSD is the exposure to one of these events. They base the diagnosis literally on the exposure. However, instead of recognizing that these are abnormal situations, what happens is they actually pathologize the human reaction to it, and then start treating the individual as if there is something wrong with the individual, when actually the problem is with the situation. Conflict is not normal. Vanessa Pupalak, she's a professor in Notre Dame University. She has this paper where she says that trauma is a normal reaction to an abnormal situation, right? So when it comes to understanding trauma in the Sri Lankan context, which has gone through conflict, before the conflict there was civil, like JVP violence. I mean, there has been a lot of quote-unquote abnormal situations in that sense, and the tsunami, and then now the violent extremism, and the poverty, the economic crisis. Look into all these situations. Rather than labeling and pathologizing the human reaction to it, I would say we really need to understand that humans are trying to figure some way in which they can survive these abnormal situations. Unless we can do something about the situations themselves, purely and exclusively labeling individuals and trying to fix the individuals and then putting them back in that same situation, I don't think it's going to work, right? We will have to help people, obviously. I'm not saying there is nothing that these people need. Obviously, they need help, right? Whether it is psychotherapy or psychiatric help. I'm not saying no to that. However, I'm questioning the way we approach it, how we understand their reactions. So when it comes to working with the people, rather than looking at them as like vulnerable, sick people who need help, we can recognize, no, these are survivors. They are in a process of figuring out, how am I going to deal with this situation? So trauma, to me, in that sense, actually is a way of living, literally. It's just a way of living within circumstances or situations that are extraordinary in that sense, that are beyond what we regard as normal, average, mundane, and to respect the people, knowing that there is no way in which we can recommend people to react to these situations, because there is no right way to respond to these situations. So people will have their unique, very creative ways of dealing with it. And then for us to recognize, I see you as a survivor and not just as a victim, a vulnerable victim. I see you as a survivor and respect those capacities. And let's see how to use those capacities in a more healthy way, more functional way. For me, that is how I would approach trauma, whether it is in Sri Lanka or elsewhere. In the Sri Lankan situation, I do see trauma surfacing in so many ways. For example, after the conflict, there was sort of a surge of crimes in the Sri Lankan context. I mean, Grisaka, if you remember, right? There was all these social phenomena that were coming up. Domestic violence rates were going up, suicide rates were going up, and then other kinds of sort of day-to-day social, like theft and threatening, all sorts of stuff happening. Again, whether we are going to think about the individual as the problem, or whether we are going to recognize, no, these are people who are trying to come to some terms with what they had to go through during the conflict. And if that's the case, then rehabilitation, reconciliation, these processes, to recognize that without just working with the individual, the fact that we need to work with systems, the fact that we need to work with policies, changing structures, almost cultural value systems are needed if individuals are to heal what we would call as trauma.
Something you mentioned while you were answering this question on trauma is the Grisaka. We're talking about the trauma post-conflict that emerged. Can you explain a little bit about why you mentioned that the Grisaka was a consequence of trauma?
That within trauma, there are two ways of looking at it. We talk about individual trauma, we talk about collective trauma, right? And there are other categories, so intergenerational trauma, there are so many other categories too. Now, collective trauma is, simply put, the idea that rather than an individual, a whole group, as a group, we face certain experiences. The group can be defined based on your gender, your ethnicity, your religion, or geographical location where you live, right? Age. So as a collective, when we face traumatic events, as a collective, that there is a collective effect. So if you think about the conflict in that sense, the Sinhalese versus Tamils, and then Muslims as a third party who also had a different way of experiencing the conflict. Grisaka, the concept, there have been a lot of studies, so I'm drawing from a lot of studies in saying what I'm saying here. It's from a more conceptual framework. It's a concept. Grisaka is a concept that represents something. There was an individual, of course, just like the Grisaka, but if you really think about it from a broader perspective, something within the society emerging as what you call as the abject, the unwanted, right? So conflict as something that disrupts established systems, conflict as an occurrence that destroys established values. People sort of are used to believing in certain things, expecting future to be predictable in certain ways. All these things are destroyed within a conflict because you have no idea when the bomb is going to blast, who is going to die next. There's this intense, significant level of uncertainty that comes up when it comes to complex situations. When that's the case, everything that is familiar, established systems breaking down, balancing it or compensating for that lack of clarity, lack of predictability, lack of stability, people try to seek some kind of stability in their life against this sort of instability on their face, almost like it's a day-to-day occurrence, not knowing what is going to happen. So seeking stability in that sense, people do it in all sorts of ways. Some may seek by sort of micro-oriented planning, right, on a day-to-day basis. But one of the sort of more psychological ways in which people try to seek stability is by trying to understand the instability, some way in which they can make sense of the instability. So one of the ways in anthropologically Grisaka has been explained is that the concept of Grisaka is one way in which people sort of put all these uncertainties into one form. So Grisaka stands for that sense of instability, that sense of the need to say, okay, this is the instability, this is the problem, right? Grisaka has a representation of that confusion, that sort of discomfort with instability. But now there is a form to it. There is a given expression to it, a word to refer to it. So Grisaka can be about people's sort of unmet sexual desires. Grisaka can be about stealing. Grisaka can be about psychopathology. All these concepts that sort of unsettle people are then directed towards this one construct, which then we call as Grisaka. Grisaka can be about recreational drug abuse. Grisaka represents so many things. So society always does that, right? We need meaning. Human species are literally driven by this need to understand. We don't like when we don't understand things. So if you can't understand something, what we do is we sort of somehow put all these unknown things into one group. And Grisaka, during that time, actually sort of stood for all these uncertainties and confusions and questions that people were grappling with.
Okay, very interesting. Thank you. You had mentioned that you also worked in Sri Lanka in the post-tsunami space. You had also worked in the post-war phase in this country. Can you explain a little bit about what is the work you did post-tsunami?
Post-tsunami, there were different kinds of work I did, but maybe primarily two things. One kind of work was about evaluating programs that were conducted primarily by non-governmental organizations to see whether they have been impactful, effective. If so, what has been the effect, and then also what could have, should have improved. The other kind of work was a research project that I and a group of people actually, definitely I cannot take the credit for it. It was a group of us who built this psychosocial assessment tool, well-being assessment tool with Columbia University. That was also post-tsunami. So the first kind of work in terms of evaluation, monitoring and evaluation, I still remember this one specific project that I evaluated with another friend of mine, where it was about building houses for a fisherman community. And I mean, the houses were beautiful, it was designed by an architect from Colombo, like big windows, beautiful houses. So the people were of course happy with the house. So they did get the house and they were happy with it. But the point is, these houses were built more than, really, really far away from the sea. I know there was a government regulation at the time that they have to be at least 50 kilometers away from the sea because of the whole tsunami threat. However, these houses were way far further into the land. That was an issue. And there was no transportation facilities to go from the house to the sea. So they were really struggling with, okay, how are we going to continue with our livelihood now? Secondly, as I said, these houses are built with big windows, they were beautiful houses. They were like really well-designed houses. The point is, these houses are next to a jungle. There's a lot of insects, mosquitoes, and sometimes serpents could come into the house. Now, when you really think about it, why? A lot of money was spent, right? Really, a lot of money was spent on this project, which could have been spent so much more effectively. The problem was lack of communication between the community and the people who were making decisions. And this is a sort of abused truth in this field, right? There is no coordination, communication between the people who are going to benefit from whatever project and the people who are making the decisions. So if they just asked people would have told them, don't put this much of huge windows in these houses because that is not functional, that is not practical. And then people would have also said, maybe save some money from the houses to build a road from the place where they are building houses to the sea, at least for them to go there by bicycle. But given that communication piece was missing, very unfortunate, but it's a waste of money. People were not necessarily living in those houses after 6 months. They were finding other ways, renting houses close to the sea, because they had to go with their livelihood, right? Who's going to give them money otherwise? Some people sort of deciding to sell the houses or rent the houses to some other families, but then they would go back to the sea. So this is just one example, but this lesson, lack of communication between the decision makers and the beneficiaries, it's an established, unfortunate reality in this field. The well-being assessment tool with the Columbia University was a really successful one, actually. It's the first well-being assessment methodology built in Sri Lanka, and it has been now used in other countries too. Again, we worked in Monragala and Batikalu. There were different places in Sri Lanka that we conducted this research. It's a huge survey, and then using the data, building this assessment methodology as well as a model, a psychosocial well-being model with key 5 main domains. And the model is informed by what you call as, again, more towards social constructionism, and then also a lot of influence from writers like Paulo Freire, how these scholars define power when it comes to community settings. So a lot of conceptual understandings are also drawn into this model, but then also supported by actual data that we gathered from the community. And there was a book published after the model was produced. So those two really stands out.
So the well-being assessment tool was for victims of the tsunami?
Primarily the samples included survivors of the tsunami, but the model is not necessarily limited in its application to survivors of tsunami. Any kind of human emergencies, human sort of catastrophes, whether it is conflict, tsunami, earthquakes, massive human catastrophes, the model would be very helpful. But going beyond that, even on a day-to-day basis, to just assess well-being levels in a given community, the model would definitely have applied value.
I noticed something. You refer to these people as survivors, and previously also in another phase of discussion, you were talking about survivors, and you were not using the word victim. I've heard various narratives about how using the label victim is not empowering, and how survivor is a better label to call people by. What are your thoughts on that?
Maybe based on the fact that I don't know how I have worked with thousands of people by now, individually and then as communities. So I don't think almost instinctively it comes up. I don't think I see them as victims. It is not natural to me to see them as victims, because the more you talk with people who have gone through these experiences, you recognize how mature, how skilled, how capable people are. It never stops to amaze you. I mean, I'll tell you one example. I remember during Tsunami, I was sort of again with a group of friends. I was going to these villages, and there was this man. I mean, he had lost a lot. He had lost his family, lost his house. He was just a lone survivor in that sense. But and there was flooding. I mean, still the water was coming, and there was a lot of floods. And he had found this table that was again floating in the water, and then he had sort of secured the table, and he was collecting photographs that were floating on the water. He had no idea who these photographs belongs to, but when you talk to him, what he told me was that, well, at one point, someday, these will be the only remains of people to some people. And I know they are going to be valuable, so I'm going to save them. I mean, if you think about it, right, that's extraordinary for him to think like that in the midst of losing everything. So that's what I'm trying to say. Like, the more you work with people who have gone through these unbelievably difficult experiences, you recognize that is something that is added into their lives. Clinically and in the scholarly literature, probably you have heard of this post-traumatic growth. There is this concept that when people go through these experiences, actually you grow. There are things that are added to you. I mean, it's a huge cost to pay, of course, to get this growth, and yet not to deny it, not to dismiss it, and just to see them as victims, which to me is very disrespectful. So I would, of course, go with the word survivor.
Thank you. It just reminds me of an article I read a couple of months back, where this victim or survivor, maybe I should call her survivor, of rape. She was raped in her university, and she had written this long article about how people were encouraging herself to refer to herself as a survivor and not as a victim, because survivor is more empowering and victim is disempowering, and survivor was a better word to use to refer herself to. And she had written this response to that pressure, if I may, and she had spoken about how she considers herself a victim of the acts of this rapist, and she will continue to be so. And she does not think of the word victim as something that makes her weak or as something that is disempowering. She is like embracing that label, and she wants to be a victim, like fully. So that was an interesting article I read on the topic. But I think the victims or the survivors or the people who have gone through these issues should perhaps tell us what they want us to call them, maybe. And when we're not at a juncture where we can know that, maybe it's better to call them survivor rather than victim, because not everyone will think like this lady as well, right?
I totally agree with you, Amina. If the person himself or herself choose to be called as a victim or a survivor, I would definitely respect that. That's their right. They choose what they want to call themselves. Having said that, from a more clinical perspective, empowerment is not necessarily something that we can give anybody, right? Empowerment is something that people need to sort of build within. If I feel as, again, purely clinically speaking, if I feel as if the label of victim is somehow sort of blocking that growth, blocking the sort of growth of agency and empowerment, I would challenge it in a quite empathetic way, of course, not directly. So that would be the only place where I would sort of work with this labeling of victim versus survivor. Other than that, definitely, if people want to identify themselves as victims, I would definitely respect that. That's not my place to challenge.
Okay, thank you. On to our next question. I'd like to ask you about something which is a hot topic for quite a long time, the field of reconciliation. So this has been something where different people have had different views about it. It's also, again, multidimensional. There are people in this country who strongly advocate for the fact that it is not moving forward in this country, and I'm talking post-war. And there are some who believe they've done a good job of it in the country. This is a broad question, but what are your thoughts on reconciliation in Sri Lanka?
Post-war, there have been a lot of efforts, right? We need to recognize the fact that there have been a lot of efforts when it comes to reconciliation. Whether they have been effective enough, whether they have been done the best way that they should have been practiced, of course there are questions. But to recognize the fact that there are a lot of people who want to do something, and there are people who have actually tried to do something, and I do want to respect that. Having said that, I think when it comes to the reconciliation part, there are all sorts of definitional understandings of what reconciliation means, but based on the research that I have done and the research papers that I've read so far on reconciliation, one of the key things that's sort of repeatedly emphasized is that reconciliation fundamentally at its core is about harmonious relationships between communities. That's what reconciliation literally bottles down to. So if you think about that and then look into the kind of reconciliation programs that have been conducted in the post-war Sri Lankan context, you need to, quite unfortunate, but you need to recognize the fact that we haven't done much when it comes to building harmonious relationships between people, right? Rehabilitation seemed to be much more prominent in the Sri Lankan context than reconciliation. For some reason, there have been a lot of rehabilitation programs, especially state-sponsored and state-controlled rehabilitation programs, which itself poses some questions. State is a part of the conflict, right? They were one party who. I don't want to get into the politics of it. After all, the state has the responsibility to avoid conflict, so they have to play a role in any kind of conflict. But the point is that when state is one party who was actively involved in the conflict, they themselves also being the people who are trying to rehabilitate, there are a lot of questions about it. Again, I don't think we have the time to get into each and every of those problems, but it's pretty understandable that there are a lot of problems about that at a conceptual level as well as a practical level. So, and that's one problem. And then also rehabilitation, definition-wise, rehabilitation is about returning to a previous normal state. So the pre-war normalcy. If we only can be like that, if we can be like before the conflict, before the tsunami, before the Easter attack, that is again at a conceptual and a practical level problems about that understanding, because like we discussed, these are experiences that fundamentally change people. There is no way that we can be like before after going through these experiences. It's an anomaly almost. It cannot work like that. So more than rehabilitation in that sense, having this sort of predefined version, this is how you should be, so let me rehabilitate you into that framework so that you fit into that framework. Instead of that understanding, which is there are a lot of problems about power and abuse and dominance when you think about it, rehabilitation in that sense. Rather than that, if you go with reconciliation, which allows you to recognize that people evolve, people change, people adapt when they go through these experiences. So this is where we were, of course, but during this period, because we were going through this experience, we have changed, and there is no way for us to define that change because that change is extremely complex. But this is where we are now, all of us, because we have gone through these experiences one way or the other. So if this is where we are, how are we going to rebuild different relationships? Not to deny the history, recognizing the history and of course taking accountability for whatever that happened, and then moving forward, rebuild relationships which are not defined by what it was before, because what it was before has changed drastically, right? But what it can be. So reconciliation to me is sort of more future oriented, whereas rehabilitation seemed to be more past oriented, right? And then the relationship, harmonious relationships. So really trying to build, understand at a grassroots level what matters to people. I mean, you were a part of my research too. Thank you for that, Amina. But one of the things that really came up in the interviews was how people are not worried about, like group identity. It's definitely matters to them, but fundamentally what they're saying is that if they can have this sort of conflict-free, harmonious relationship with their neighbor, that's what they're asking for. We don't want to fight with each other. We need to have a functional, sort of friendly, warm relationship with each other. They talk about it in all sorts of ways, but fundamentally they are talking about harmonious relationships. So to me, more than rehabilitation, reconciliation to be sort of promoted, and then also whether it is the post-conflict, post-tsunami, these contexts, whether it is the government, non-governmental, community-oriented organizations, really looking into rebuilding different, sort of renewed, harmonious relationships. I would say that if that can happen, I really see hope there. But I really don't see much that has happened so far, which is actually geared towards that kind of understanding of reconciliation.
Okay, thank you very much. Taking on from that aspect which you were talking about, reconciliation versus rehabilitation, and holding on to rehabilitation and moving that with the next question, moving forward with that for the next question. When we consider the Easter attack of 2019, the Easter Sunday attack of 2019, currently there are people under detention. And for the longest time now, there's been this subject of rehabilitation for those individuals and those people under detention. And there has been quite a debate, mostly siding on the fact that rehabilitation is not something people want in this context of the Easter attack and the detainees. But you've worked with some survivors of this attack. You're in the field. What are your thoughts on rehabilitating detainees? Because some of the main narratives of this is especially coming from the Muslim community, and there are various aspects to it. For example, Muslims feel like it might be a threat to their religion or their faith. There's a stigma around it. They ask the question why, because some of them feel that their family members are not even guilty, so why undergo rehab? What are your thoughts on this issue?
When it comes to working with at a conceptual level, I think some of these programs are driven by this understanding that when it comes to extremists, right, as the word itself says, that they have been trained or they have been brainwashed with certain extreme ideologies. So rehabilitation as the approach to challenge those ideologies and to allow them to unlearn and then relearn more social friendly, functional ways of understanding. If that is the understanding that drives these rehabilitation programs, I would agree with that. I haven't worked with detainees in the Sri Lankan context, but all the research papers that I've read so far about working with extremists, I do know that there is a very small, very small unit within the larger community who are taken into these ideologies for all sorts of reasons. I mean, why somebody would believe in extreme ideologies is, I really don't think it is about the religion per se. There are a lot of individual, historical, political factors that shape someone's choice to believe in extreme ideology. So that would be one point. Secondly, one of the things that I've noticed in the Sri Lankan context is the detainees. I'm not necessarily sure whether we can confirm without any doubt that these detainees are actually that extreme unit. There are a lot of questions about who is taken into custody, on what grounds, who decides that these are the suspects, what is the processes involved, what are the processes involved in really carefully scrutinizing this evidence and then deciding, okay, yeah, this is valuable evidence and this confirms that these people should be detained. So there are a lot of questions about that. So that would be another huge problem here. Thirdly, when it comes to people who have been detained, given that the group of people who are detained are not necessarily homogeneous. I mean, it's such a diverse group of people who are put together. Another problem in the Sri Lankan context is that some people among these detainees are actually radicalized, but some people are not. But when you put both these groups together and literally keep them together for a significant period of time and then release them, what happens is people who were not radicalized before, it's almost as if they're going through a training course. They're being exposed during the period that they are detained. And when they come out, people who are actually not radicalized, people very functional, healthy in their understanding of the religion or their life, come out with all sorts of confused ideas. Right? That would be another problem about how we do it in Sri Lankan context. Rehabilitation in that sense, as I said, while if it is about radicalized, clearly evidence-based approaches that would decide, okay, these are people who have been radicalized so that they need help, that has to happen. The rehabilitation is not, in that process, rehabilitation is not necessarily about returning them to a previous state, but about, questioning these ideas and helping them to understand that there is a better way of understanding whatever beliefs that they are holding on to. But we have to make sure that the process of selecting these people have to be, fundamentally evidence-based. Can't be about political ideologies, personal goals, none. A huge problem, the fourth problem that I see is, for the most part in the Sri Lankan context, these efforts are security-oriented. So who is taken into custody, what is being done, are understood as well as planned from a hardcore security approach. It's about asserting security. It is not about understanding complexity of the social political phenomenon. It is not about really making sure that the communities rebuild themselves and rebuild these relationships so that they can have this sustainable peace in the future. It's literally about headhunting, which is about security. Not that security is not important, security is important, but if it is only security that direct and guide these interventions, there are a lot of problems about that, right? Security is only one part of it. You can detain people, but once they go back, they are going back into a community. People need to know how to live with each other, otherwise it is going to come up again, right? So in the lack of that community rebuilding process, reconciliation at the grassroots level, simply focusing on security and detaining people, I really don't think is good. It hasn't worked anywhere.
Thank you so much. I really appreciate this, and I apologize for the slight connection issues that took place at the end of this conversation. I'll go back to the recording and see how I can hopefully fix that. Thank you so much for your time, Dr. Udeni, and it's so nice to see you. When you came down a couple of weeks ago, I couldn't really see you because you were with the mask, but I'm so happy to see you and engage with you in this way. So my appreciation for your time and all of your answers, which have for sure taught me a lot and which I'll be taking with me into the future. So thank you once again. I hope you have a really great day. And please, I wish you all the best in continuing the work that you're doing.